Hello class, today we are going to learn about PASI, which is Psoriasis Area and Severity Index. This topic is very essential for any dermatology student and resident. So in today's class, we'll know how to calculate PASI and what is the importance of PASI. PASI, that is Psoriasis Area and Severity Index, is calculated for chronic plaque psoriasis, not for any other like pustular psoriasis. It is done for chronic plaque psoriasis. So if this is a patient of chronic plaque psoriasis, we'll divide the body into four parts. First will be head and neck. Next will be the upper limbs. Both the upper limbs will be counted as the next part. The third is the trunk. Here we include the buttocks in the trunk. And fourth and the last part will be the lower limbs. Both the lower limbs together will constitute the fourth part. Now for each part we have a weighted score. What is weighted score? Since each part represents a specific percentage of whole body surface area, it is given a weightage. So head and neck represents only 10% of the whole body surface area. So it is given a factor of 0.1. The upper limbs both together represent 20% of whole body surface area. So it is given a factor of 0.2, while trunk represents 30% of the whole body surface area, a factor of 0.3, and lower limbs both together represents 40% of whole body surface area. It is given a factor of 0.4. Next, we need to know the area score for each part. In this, we have a table. Now we will know, according to this table, what is the area score. So, percentage of that region involved is seen. If it is 0%, area score will be 0. If it is less than 10%, area score will be 1. Say in head and neck, 15% of head and neck were involved with chronic plaque psoriasis. So area score will be 2. And upper limbs, we say 35% or 40% was involved. Area score will be 3. If say chronic plaque psoriasis involved round about 60% of the trunk, area score will be 4. If both lower limbs together, we see that 80% of lower limbs were involved with chronic plaque psoriasis. Area score will be 5. Now the plaques of psoriasis in each of these 4 regions are assessed for 3 things: erythema, induration and desquamation. These are the characteristics of psoriasis plaques. So these 3 things are assessed. A simple way to remember it is the festival Eid. E plus I plus D. Erythema, induration and desquamation. Now each of these 3 characteristics is given a score from 0 to 4. If it is none, like no erythema or induration or desquamation, score is 0. If it is mild, it is 1, moderate is 2, severe is 3 and very severe is 4. This score is given by the physician who is doing the assessment. So it might differ a bit between 2 physicians. Now we will examine the plaques of head and neck. Say the erythema was moderate, so we give a score of 2. The induration was mild, so we give a score of 1. And desquamation or scaling was severe, we give a score of 3. Now we add the scores. 2 plus 1 plus 3 is 6. We write it down. For head and neck, it is 6. Now we calculate each of these three characteristics for upper limbs and we give a score. Say in upper limbs, the erythema, induration and desquamation all were mild. So 1 plus 1 plus 1 which is equal to 3. Moving on to trunk. In trunk we saw that erythema was mild, we give 1. Induration was moderate, we give 2. Plus desquamation or scaling was severe, we give 3. So 1 plus 2 plus 3 is 6. We write it down. Now in lower limbs we see that erythema was moderate, we give 2, plus induration was also moderate, we give 2, while scaling was severe, we give 3. So 2 plus 2 plus 3 is 7. We'll note it down as 7. Now for head and neck, we will calculate the PASI. It is the sum, that is E plus I plus D for head and neck was 6 into 2, which was the area score, into 0.1, which was the weightage factor. So 6 into 2 into 0.1 will be 1.2. For upper limbs, the PASI will be 3 into 3 into 0.2, which comes out as 1.8. For trunk, it will be 6 into 4 into 0.3, which is 7.2. The PASI for lower limbs will be 7 into 5 into 0.4, which is 14. Now what we do, we add all the PASIs of the 4 region. So 1.2 plus 1.8 plus 7.2 plus 14 comes out to be 24.2. So the PASI for this patient, representative patient, is 24.2. The maximum PASI for any patient can be 72. The minimum is 0. Minimum is 0 means there is no psoriasis. And 72 means all regions are almost fully covered with severe psoriasis. So now according to the PASI, the disease severity of psoriasis is assessed. So if PASI is less than 5, psoriasis is mild, 5 to 10 is moderate, more than 10 is severe. Now there are some terms that you will come across in many articles and you may be even asked in Viva, like PASI 50, PASI 75, PASI 90 and PASI 100. Now if the maximum score can be 72, what is PASI 75? You have to understand this. PASI 50 means 50% reduction of PASI from the baseline due to whatever treatment you have given. Similarly, PASI 75 is 75% reduction, PASI 90 is 90% reduction, and PASI 100 is 100% reduction. That is, the psoriasis has been completely cleared off. Now let us understand this with an example. Say the baseline PASI of the patient was 24.2 as we have calculated. Now we give a treatment for about 12 weeks. The new PASI at 12 weeks is 12.1. Now we calculate the percentage reduction of PASI. So the reduction will be 24.2 minus 12.1 divided by the baseline 24.2 into 100. So 24.2 minus 12.1 is 12.1 divided by 24.2 into 100. So if we see this way, it comes out to be 50%. Now we can express this with this statement. With this treatment at 12 weeks, PASI 50 was achieved. The treatment is whatever you have given, say any biologic or methotrexate, whatever you have given. I hope you have understood the concept. So for your reference, this is the table. PASI 50 means moderate improvement, that is partial control. PASI 75 means good improvement. PASI 90 means excellent improvement. And PASI 100 is the complete clearance. That is the ideal skin, clear skin that should be achieved. PASI 75 is the standard target in older biologics, while newer ones, the target is PASI 90. So, what is the importance of PASI? It helps in objective measurement of disease severity. It has taken into account both the area of involvement of psoriasis and the intensity of the plaques. The next importance is that it helps in therapy decisions. It becomes a basis of therapy decisions where it shows whether the disease is mild, moderate, and severe, and accordingly we can give the treatment. The third point is monitoring or the follow up of the treatment response. So, if you follow up, there is decrease in PASI, you understand how much is the treatment effective and all. The fourth one is it is used in comparisons of two therapies or two drugs in clinical trials. Now there are some limitations of PASI, though it is quite objective, but there can be minor subjective variations which may differ from physician to physician. Next limitation is that it is a bit complex and time consuming to calculate PASI for each patient and each visit. Though I have tried to make it very easy, but this can be considered. Third is it is less sensitive to small changes. Whether it is small change in area or erythema or in duration, it is less sensitive in for that. Fourth is that it doesn't take into account the psychological burden or the quality of life in these psoriatic patients. The fifth limitation which we can include is that PASI is for chronic plaque psoriasis and not any other type of psoriasis like pustular psoriasis. We should also know some other methods of psoriasis measurement. Like we know PASI, next is self-administered PASI, then physician's global assessment, then is lattice system global assessment, simplified psoriasis index, and the photographs of the patients that we should keep serially. Now, nail psoriasis can be assessed by NAPSI, which is Nail Psoriasis Severity Index, and NAPPA, that is Nail Assessment in Psoriasis and Psoriatic Arthritis. With this, we have come to the end of today's class. Thank you for watching. There are many other topics of concept building in dermatology in the channel. If you like them, like and subscribe. For now, bye. See you in the next class.